welcome back to the SLTV. This video was created from a full-length article on our health website. I will drop the link to the article in the description box. After watching, please make sure you like, share, and subscribe. And please do not forget to come back for more.
When you're
See you soon.
expecting, you've got so much on your mind, especially when it comes to keeping you and your little one healthy. Well, one of the best tools we have for that is vaccination. So in this explainer, we're going to break down exactly why it's a great idea, how it all works, and everything you need to know.
And this is the big one, right? It's the question on every mom-to-be's mind, and it's a really important one. It's totally natural to ask about safety. So let's just dive right in and see what the experts have to say.
So first things first, why is this so important during pregnancy? Well, your body is doing something pretty incredible. Your immune system actually chills out a little bit to help protect the baby. Now that's amazing, but it can also leave you a bit more open to infections that you'd normally just brush off. What that means is that common illnesses like the flu or whooping cough can hit a lot harder when you're pregnant, and that can be risky for both you and your developing baby. So getting vaccinated is just a simple, really effective way to prevent those illnesses and any serious problems they might cause. Okay, and this is where the magic really happens. Getting vaccinated when you're pregnant isn't just about protecting you. You're actually passing on this incredible protective gift directly to your baby before they're even born. That's right, it's like a 2-for-1 deal on protection. A single vaccine gives one layer of defense to you and a whole other critical layer to your baby. How cool is that? So you might be wondering, how exactly does that work? It's a pretty amazing process, actually. You get the vaccine, and your body gets to work making these fantastic little bodyguards called antibodies. Then, those antibodies travel right across the placenta and go directly to your baby.
And this has a name. It's called passive immunity. Think of it as your baby's first line of defense, like their own little suit of armor. It protects them during those first few months of life, before they're old enough to get their own shots.
Okay, so knowing all that, what are the actual vaccines that doctors and healthcare providers recommend to keep both of you safe and healthy during these 9 months? Let's get into the do's. All right, here are the big ones. The Tdap vaccine is super important because it protects your newborn from whooping cough, which can be really dangerous for them. The flu shot is a must because being pregnant puts you at a higher risk for serious complications from the flu. And then you have the RSV and COVID-19 vaccines, which give you both vital protection against some pretty serious respiratory illnesses. Now, beyond those main recommendations, there might be other shots to consider depending on your own health or, say, your travel plans. And that's exactly why having a good, open conversation with your doctor is so key. They can help figure out a plan that's made just for you.
So we've talked about the do's, but it's just as important to know about the don'ts. There are certain vaccines that aren't recommended during pregnancy and should really wait until after your baby arrives. The main difference here is pretty simple. The vaccines that are recommended, like the flu shot and Tdap, are called inactivated. That just means they don't have any live virus in them. The ones you want to avoid are called live vaccines. They use a weakened, but still live version of the virus, and we generally steer clear of those during pregnancy just to be extra safe. So this list includes some common ones you've probably heard of, like MMR for measles, mumps, and rubella, and the vaccine for chickenpox. The absolute best time to get these is either a month before you even start trying to conceive, or you can just wait until after your baby is born. And this is a huge plug for planning ahead, right? If you know you're going to be trying for a baby, having a chat with your doctor beforehand to get all your vaccinations up to date is honestly one of the best things you can do to prepare. All right, we have covered a lot of ground here. The why, the how, the do's, the don'ts. So what does this all mean for you and your next steps? I love this quote because it just says it all, doesn't it? Getting vaccinated isn't just another thing to check off your to-do list. It is truly one of the first and most powerful gifts you can give your child to help them get the best possible start in life. You know, our whole goal with this explainer is to help you feel totally ready and confident when you walk into your doctor's office. We want you to be able to have a great conversation and work together to figure out the best plan for you and your growing family. We really hope this has helped clear things up and shown you what a crucial role vaccination plays during pregnancy. Now you have the info you need to team up with your doctor and create the perfect protective plan for your incredible journey into motherhood.
Please subscribe.